the 2021 legislative session. My name is Tiffany Seibert-Yakel, and I use she, her pronouns, Research and Policy Director at the Women's Fund of Omaha. I'll be joined today in this conversation by Kelsey Waldron, our amazing policy and research associate here at the Women's Fund. And you also see an appearance from Jill Hagan, our communications director. So it's a team effort. As always, just a little bit of housekeeping before we get started. We'll have participants on mute, at least until we get through the presentation the brief presentation that we have prepared. But if you want to submit questions through the Q&A function, that'd be great, as well as the chat. Jill will be dropping lots of links in there as we talk, so keep an eye on that. And again, feel free to add questions or clarifying comments in the chat, and we'll try to get to those either as we're moving through the conversation or at the end. This session is being recorded and closed captioning is available. If you click live transcript below and click show subtitle, you should be able to access that. We are going to try to bring up a PowerPoint presentation here. Of course, I was having technical difficulties and couldn't bring it up. So give us just a second and we will try to get some visuals going in the meantime. But while we're waiting on that and trying to get that rolling, just wanted to give you a sort of status update on the legislative session. Today is the last day. They adjourned, they call it sine die today. They adjourned early. They were scheduled to go into early June, but felt that they had completed the business that they were able to get through. And so they adjourned early. Yesterday, they took up 3 vetoes by the governor, which we'll talk about a little bit. Well, technically 5 vetoes there because there were A bills associated with a couple of the bills. Those are appropriations bills. So any bill that spends money has an A bill that follows. But the legislature successfully overrode all 3 vetoes by the governor yesterday. So that was exciting. A couple of those are bills that we were really interested in and we'll talk a little bit about. But just so you all know how this works, they'll go into this time in between sessions is called the interim. The legislature will conduct interim studies, they'll hold hearings, they'll work on their bills that they introduced last year that they want to continue, or they'll work on new bills that they want to introduce in the next session. That's what the interim is for. 110 interim studies have been introduced. Usually each committee prioritizes a couple of interim studies. They may hold hearings on them and dig into them deeply with their committee staff. Otherwise, legislators can individually work on bills that they have introduced as interim studies to prepare for the next session. A unique aspect of this year is that we know there will be a special session coming in the fall for redistricting. So because of delays in census data, a responsibility of the legislature every 10 years after the full census is to realign legislative districts to correspond to population changes. And so the legislature normally does that in the course of business in this year following a census, a 10-year census. But because of the delay in data, they don't have it yet. And so weren't able to do it. So they'll be coming back in September as a full legislature to do redistricting, which is a very important function of the legislature in ensuring that everyone's vote matters and is counted. It can also be a highly partisan issue and very politically charged. That will, when they come back and convene, there will be a question, can they take up other issues in that time? A special session can only deal with items that are included in the call for the special session. So either a legislature can call the special session and they write a letter and sort of define what they'll be taking up, or the governor can call it. But either way, there's usually very narrowly defined purpose for the special session, and that's the realm in which they can legislate during that time. Also, an important question that we get a lot is what happens to bills that didn't advance this session that I really care about or want to make sure they don't move? Because this is a 2-year cycle, this year was the first year, they'll come back next year, and any bill that was not passed or indefinitely postponed, so functionally killed in some manner, will sort of still be alive for movement next session. And so it provides an opportunity over the interim to come back and work on issues that you care about and do more advocacy to hopefully move them or keep them where they are. If you don't like them, don't support them. But bills that didn't pass or were not IPP'd will still exist next year and provide opportunities to move. So there were 684 bills this year introduced total, 55 passed. As we mentioned, three substantive vetoes, all 3 were overridden. The Women's Fund had a very busy year. We took a position on 46 pieces of legislation, 11 of which passed. And we will be active on a couple interim studies that we will continue to engage with you all over the summer. So with that, we'll give you a bit of an overview of some of our priorities, where they landed, and what we will continue to work on for next session. So in our freedom from violence area, we had 3 big wins, and I'll let Kelsey give an overview of LB 320.
Hi everyone, Kelsey Waldron, she, her pronouns with the Women's Fund. So our first bill in this area that we had a really big win with was LB 320. And this was a housing protection bill. The primary bill pertained to domestic violence protections, but a whole host of other housing bills were attached to it. So this bill also really belongs in our economic security issue area, but we know that there are really intrinsic links between the two, between freedom from violence and economic security. So the underlying bill 320 in this really pertained to domestic violence survivors accessing an early termination of lease from their rental agreement. In the aftermath of violence, if their housing is no longer safe, they need to obtain new housing and have an early termination of lease. They can do so without additional costs, without being responsible for additional months of the remaining lease, except for the current one in the month that they terminate. And then it also expanded existing protections from eviction for domestic violence survivors when the violation of the lease was under these certain circumstances, when a violation of a lease occurred as a direct result of domestic violence experienced. The survivor would not be held responsible for that and could not be evicted for their victimization, or could not be evicted for their victimization that they had experienced. And then, as I said, there were a host of other housing bills that were attached to this one that the Women's Fund supported. So those bills included LB 402. This provides a semi-annual report to the legislature about eviction data. This is particularly important as we're looking at direct service providers on where they're prioritizing their resources to support affordable housing and renter protections, and as we're looking forward to future years and policy work. This bill also included LB 246. And so this bill would require when a landlord files for eviction proceedings, they have to list the statutory reason that they are seeking eviction, a really wild idea that someone should know exactly why they're being evicted, but was not previously required. So now they'd be required to list the statutory reason. That way, somebody responding to an eviction notice is better prepared in their defense, understanding exactly why they're facing eviction. Then it also included LB 277. So this was a bill to harmonize some mobile home landlord tenant protections with our other landlord, Residential Landlord Tenant Act. So this is a little bit more technical, but it ensures that renters that are renting from mobile homes have and can access the same protections to renters who may be renting from an apartment or a condo, ensuring that regardless of kind of what unit you're renting, you have the same protections as a tenant. And then this package also included LB 45. This is another more technical one, but it pertained to continuances for eviction hearings. So essentially, it's a process of requesting from a judge a rescheduling of an eviction hearing. The current process is landlords have a tremendous say in when an eviction hearing is scheduled, and then tenants are provided notice of that. And currently there is a very, very high threshold for tenants to request a rescheduling if they're unable to attend through no fault of their own, and a much higher standard for tenants than there is for landlords requesting a rescheduling. So it creates this real inequity in our legal system. And if a tenant is unable to make their court hearing, there is a default in our laws of eviction. So it's a real barrier to ensuring that people can remain in their homes and a real barrier to ensuring equal access to our legal systems. So this bill would provide landlords and tenants that same lower threshold that landlords currently enjoy, and that they would have that same threshold for their first request for a continuance. We saw this become a really big problem during COVID. There were some instances of tenants being positive to COVID and not being able to enter a courtroom because it's not safe for their own health and the health of the entire courtroom, but having difficulty obtaining that rescheduling of their hearing, and therefore being a threat of being evicted through no fault of their own in those hearing schedules. So that's a really important bill that was included in this. Then just a couple more. LB 46, this pertains to how eviction notices are served. It requires they be posted on the front door of the unit for the person facing eviction to ensure that tenants are actually receiving an eviction notice, that they know when their court date is. Previously, it wasn't required where that needed to be posted, and so not all tenants were actually receiving those notices and didn't know of their court date, didn't know that they were facing eviction. And then the very last one is LB 268. And so this pertains to landlords providing notice when they're entering a tenant's unit and helps strengthen that, that notice. So ensuring that tenants are getting 24 hours notice before a landlord enters, and also ensuring that landlords are entering during reasonable hours, right? So not at 3 a.m, but during reasonable hours. There are some exceptions for cases of emergencies, such as a burst pipe, when a landlord might need to get in a more urgent basis, but really ensuring that everyone knows who's entering their home, when, and why. So Tiffany, you want to talk about the two others that we had this session?
Yeah, we had some, the Women's Fund has long been working on the issue of supporting survivors of sexual assault with the costs of medical care that may result, or other costs that result from their victimization. So LB 372 and LB 497 are both improvements to the existing crime victims reparations program, which is intended to reimburse victims of violent crime for costs associated with their crime. LB 372 eliminated a requirement that survivors would have to report their victimization to law enforcement within 3 days. We know there are many reasons that particularly sexual assault survivors, but also trafficking survivors and domestic abuse survivors may not report immediately. And so we wanted to lift that unnecessary barrier. Additionally, LB 372 lifts a notarization requirement. So the application had to be notarized before folks could submit all of their evidence and documentation to receive reimbursement from the CVR program. And then 497 is a really important bill. So for a survivor of sexual assault that seeks medical care, they're currently eligible for reimbursement through the Crime Victims Reparations Program. But what it requires is then they have to receive a bill from the medical institution, then submit it with all proper paperwork to the CVR program, wait up to 180 days before the CVR program approves that cost and will reimburse. It can create a lot of additional stress for survivors. They may have to go into collections from the hospital side while they wait for reimbursement from a CVR program. So 497 allows for the hospitals to bill directly to the CVR program and take out that middle step of creating additional administrative hurdles for survivors and ultimately achieving the same end, using the CVR program to support the costs of medical care following sexual assault. So we're really excited about those two bills. And if you work in these spaces and any of these bills are particularly relevant to you and you want to talk with us about implementation and how we can support that, please let us know. That passing the bill is just part of the effort, right? It's also important that we implement these in a way that is effective and makes a difference. So those were what passed in that space. We have a number of bills that'll be coming back that didn't advance this session that we'll continue to work on. One is LB 183, a Megan Hunt bill that provides for information and access to emergency contraception in hospitals for sexual assault victims. LB 118 will be a big priority for us. This is a bill to extend the duration of protection orders. And it removed the notarization requirement as well. We'll continue to work on that one in future sessions. And then Kelsey, you want to talk about our Good Samaritan?
Sure. Yeah, so LB 7 and LB 519 are highly related. They're the two Freedom from Violence Good Samaritan bills. So essentially what this ensures, LB 7 would provide legal protections for certain drug offense and sex work related offenses for individuals who are either the victim or the witness of very violent crime under two circumstances. So one, if they are reporting information about the crime to law enforcement, or if they're accessing medical care or assisting somebody accessing medical care in response to that violence. And that second option doesn't require engagement in the criminal legal system to access those legal protections. The real, objective behind this bill is ensuring that everyone is able to access healthcare without fear of criminal repercussion, or for those who want to engage in the criminal legal system, that they're able to do so without fear of criminal repercussion. And then 519 is a very similar bill. It would provide legal protections for certain drug offense and then also minor alcohol offenses for individuals who have experienced sexual assault. And again, under those same circumstances of when they're seeking or helping a victim access healthcare in response to the assault, or when they're engaging with law enforcement in response to the assault. So both of those bills, the LB 7 was introduced by Senator Blood, LB 519 was introduced by Senator Moorfeld. They're both in Judiciary Committee, and those are both in committee, so we'll continue to work on them. As Tiffany said, those will be brought over to the next biennium, and we'll continue working in them over the interim and trying to push them next session.
We had some real big wins in our economic stability and leadership area this session. One of the biggest is LB 451, the bill to ban natural hair discrimination in the workplace. Woo, yay. This has been a multiple year effort now at this point. I want to give a tremendous amount of credit to the work of IB Black Girl and their advocacy and all the incredible Black women who used their voice and shared their experiences to educate our legislature and provide the movement to support this advancing this year. As you all may remember, Governor Ricketts vetoed this legislation last year after it passed. Senator Michaela Cavanaugh had a bill that passed the legislature that the governor vetoed. Senator Terrell McKinney introduced the bill this session and led it through the process, ultimately to be passed and signed by the governor into law. So this is an incredibly important step forward for equitable workplaces in Nebraska. We are one of 8 or 9 states now to have such a ban in place, and I'm just really grateful to Senator McKinney and his leadership and IB Black Girl for their incredible advocacy around this bill. Another huge win for us this session was LB 485. This bill would make more working families eligible for the Child Care Assistance Program. So it's sometimes called Child Care Subsidy. It's sometimes called Title 20. This will allow more families to be able to enter the workforce, stay in the workforce, and know that their children are cared for and safe at home. It increased eligibility from 130% to 185% of the federal poverty level for folks who deal in FPLs. And it also increased the eligibility at which families lose eligibility, right? So they can come on the program at 185% of the federal poverty level, and they can stay on it until they're making about 200% before they lose benefits. And what this does is ensure that people can take small raises, work more hours if they'd like, so that when they lose eligibility for the program, because they make quote unquote too much money, they're hopefully better able to support the full cost of childcare without assistance. This is an issue that I personally in various positions have been working on for over a decade. Nebraska has long been one of the lagging states in how we support working families in childcare. So this is a huge win. It's also a temporary one due to concessions that had to be made. This increase is only available currently until the end of September 2023. So we need you all, if you at all are engaged with working families who may be eligible for this program, we need help with outreach. We need you to be able to talk about it and help point people to sign up and see if they can get enrolled, so we can really demonstrate its impact. And before the program expires, we want to be able to have strong evidence of how effective it was, so we can really push to keep it, make it permanent. Similarly, LB 108, this is skipping down to the bottom. This is a bill that also increases eligibility for SNAP assistance. This bill was vetoed by the governor, so it was passed by the legislature with 33 votes. It was vetoed, and yesterday it was overridden. Woo, again. So important, ensuring more working families can have access to food assistance so that they can continue to put food on the table and work their way to economic stability. Yes, thanks, as Jill said, to all of you who reached out and supported this bill all along, but especially to those of you who helped us advocate to override the veto. That was successful, and that is just a really important development. But also note that this one is also temporary. It is also only through September 2023. And so we're going to have to come back and advocate for increased access to food assistance again in a couple of years. And then finally, LB 260, this was a bill introduced by Senator Megan Hunt and is an important advancement. It allows a person to be eligible for unemployment insurance if the reason they become disconnected from their employment is to provide care for a family member with a serious health condition. So in the absence of paid leave policies, paid family and medical leave that apply to all workers in all employment situations, this bill is a really important safety net that would allow people to have some support if they have to leave their job to care for a loved one.
So a few of the bills that unfortunately didn't pass this year, some of them will be continuing to work on next session though. But one of them this year was LB 241. So this was a bill introduced by Senator Vargas and prioritized by Senator Vargas. And it would have provided protections to meatpacking employees in light of COVID-19. So particularly what this bill did, among some of the protections were requirements for distancing between workers in their workstations. It required free access to face masks and face shields to be made available to employees, more frequent opportunities to wash hands or sanitize. And then it also had some requirements for sanitizing the facilities. And then the last really big component of this bill was to provide paid sick time to limited paid sick time to employees when they were receiving a COVID-19 test or when they were positive to COVID-19 and quarantining due to their positive case of COVID. So unfortunately, this was a bill that had support to advance beyond through general file, the first round of debate, but unfortunately did not have the support necessary to advance through the second round of debate, select file, and was bracketed on select file. So that's one that that won't be coming back up, did not pass this year, won't be coming back up, unfortunately. 258 is another case of a bill that was defeated during floor debate. So this is a bill you might remember the Women's Fund has worked on in previous iterations. It's paid sick and safe time. So this would require employers to provide their employees with 1 hour, it would be accrued paid sick and safe time. So employees would accrue 1 hour for every 30 hours worked, capped at 40 hours a year. So people could just use only 40 hours in an entire year. For some work schedules, that's about 5 days of paid sick time in an entire year. And they would be able to do so for their own personal illness or injury, to care for a family member's illness or injury. And then the safe leave component is for those who have experienced domestic violence, sexual assault, or stalking. So this allows that same 40 hours a year time away from work in order to respond to the violence they've experienced. That might be obtaining legal protections or finding new housing, accessing courthouses during 9 to 5 workday when most people when courthouses have limited hours, or banks if somebody has experienced economic abuse or needs to obtain new paperwork after the violence that they've experienced. That often can happen during people's 9 to 5 workday. They may need to take time off to ensure their safety. So this is a bill that was defeated on general file. It was prioritized by Senator Matt Hansen this year and defeated on general file. So this is one that didn't advance this year, that won't be brought back up next year, but we'll be continuing to prioritize ways to support the economic security of workers and access to paid leave in future years. Tiffany, do you want to talk about 290?
Yep. So similarly, another paid leave. This is the longer term paid family and medical leave. So whereas sick and safe is, hours up to 40 hours, sick and safe is, family and medical is weeks. It's your longer term leave. LB 290 was introduced by Senator Michaela Cavanaugh. And this is a bill that we've seen for the last several years. It's very similar, where it creates an insurance program that employers pay into. And then when an employee needs to take extended leave, the pool, the insurance program, pays their wages, a portion of their wages while they're on leave. This bill was advanced from the Business and Labor Committee and will sit ready for full debate next year. So stay tuned. And then LB 249 is a bill that is a priority for the Women's Fund that didn't advance this session, to eliminate the reliance on salary history in hiring processes. So we know that you cannot disconnect what folks are paid from any potential discrimination that may have existed specifically for women and BIPOC folks. And so when we base future salary on prior salary history, we are baking in those sort of inequitable factors that may have held down salary. And so LB 249 will be a priority for the Women's Fund that we will hopefully be able to move next session. And then finally, in our sexual literacy and repro health area, we had LB 20, which provided insurance coverage for extended supply of birth control. The bill as introduced would have required public and private insurance companies to cover up to 12 months at a time of hormonal contraception. So the pill, the patch, the ring. It was amended by the committee in advance, which was great. It was amended to 6 months at a time. So if your doc prescribes you 6 months at a time, the insurance company has to cover that 6 months. That bill awaits, it sits waiting on general file for next session. General file is the first round of debate. So we're hopeful that that one will get to move and get advanced next session. LB 67 was a bill introduced by Senator Jen Day. This removed unnecessary barriers on healthcare services that could be provided in school-based clinics, namely contraception contraceptive access and counseling was an issue that we were advocating for, and that sits in the HHS committee. And then LB 276, which was a bill introduced by Senator Megan Hunt that we supported, that would remove the requirement that a physician be physically present during a medication abortion, sort of allowing for greater access to utilizing telemedicine, like so many other areas of medicine have really integrated into their practice during this pandemic, trying to do so similarly for abortion access. And that bill will remain in the judiciary.